Hello everyone, my name is Aalavan Thayalan. I'm honored to be joined by Dr. Paul Karanicolas, a pancreatic surgeon and researcher at Sunnybrook Health Sciences Centre and a professor of surgery in clinical epidemiology at the University of Toronto. We are going to ask a few questions regarding pancreatic cancer. What are the functions of the pancreas?
The pancreas has two functions within the body. It has an endocrine function, which means producing hormones. So it produces 5 types of hormones. The most important really is called insulin, that helps regulate glucose. There's 4 other hormones that it also produces. And then it has what's called an exocrine function, which refers to the production of enzymes to help digest food and specifically to help digest carbohydrates.
What is pancreatic cancer?
So pancreatic cancer, as we commonly think of it, refers to adenocarcinoma, which is a cancer of the exocrine glands of the pancreas. There are other cells within the pancreas that can also become cancer, such as the endocrine cells, which would develop into neuroendocrine cancer. However, we tend to not to refer to those as pancreas cancer. They have a much better prognosis. So when we think of pancreas cancer, we're really referring to pancreatic exocrine adenocarcinoma, which is, again, a cancer that develops from the enzyme-producing cells in the pancreatic duct.
What are some common symptoms for pancreas cancer?
The symptoms of pancreatic cancer really depend on the location in the pancreas where the cancer develops and the extent of disease. In its earliest stages, patients may be asymptomatic. So the pancreas is located at the back of the body. So if there's a cancer in the body or tail of the pancreas, it often doesn't produce any symptoms whatsoever. And that's one of the challenges of it, is that by the time it produces symptoms, it may be quite advanced. In the head of the pancreas, the bile duct passes through the pancreas to drain into the duodenum. And so if a cancer develops in the head of the pancreas, it may obstruct the bile duct. And if that occurs, patients will typically develop jaundice. So they will develop yellow eyes, yellow skin, dark urine, and pale stools, along with itching. The other way that patients can present is with more advanced disease. So in other words, if the cancer has grown and is extending to compress nerves around the spine, patients can actually present with back pain. Or if it has actually spread to other places in the body, patients can present with obstruction of the stomach, so they may have nausea and vomiting. They may just present with weight loss and decreased energy, so really more widespread symptoms of cancer that has spread to other places.
How do you screen for pancreatic cancer?
Screening for pancreatic cancer is challenging because the overall risk of developing pancreas cancer is quite low at the population level. And often it develops and spreads quite quickly. So it's quite challenging to detect pancreas cancer at an early stage. And generally speaking, screening programs, even for high-risk individuals, have failed to show a benefit for those reasons. So there aren't, unless a patient is very, very high risk of developing pancreatic cancer, so for example, if there's a very strong family history or a genetic predisposition, we might consider screening patients with a combination of MRI of the pancreas and endoscopic ultrasound. Those would be the 2 best modalities for detecting a very small pancreatic cancer before it causes symptoms. For the most part, though, pancreatic cancer does present when patients have symptoms rather than through a screening program. Once patients do have the symptoms that we discussed, the most common test would be a CT scan of the abdomen and pelvis that would typically detect a mass present within the pancreas. And then at that point, other tests might be ordered, potentially including biopsies through endoscopic ultrasound, rarely PET scans, occasionally MRIs to look both at the pancreas and at the liver for signs of spread. In laboratory tests, there are some tumor markers that are secreted in the bloodstream that can sometimes be picked up and can be helpful.
What are the different methods of palliative care?
In terms of cancer-directed treatments, the 2 main modalities would be chemotherapy and radiation. And with chemotherapy now, in the palliative setting, it can extend survival about 4 times what it would be without the use of chemotherapy. So that can make a big difference in lengthening a patient's life. We also know from studies that quality of life is improved in patients who receive chemotherapy compared to those who do not. And that's because most of the symptoms come from the cancer progressing. And so if you can slow down the cancer from progressing, you also optimize patients' quality of life during that time. Radiation may also have a role in terms of improving what we call local control. So in other words, slowing down the growth in the location of the pancreas cancer and reducing symptoms that occur by the cancer itself. Most notably, those would be pain and signs of obstruction, both obstruction of the bile duct and obstruction of the stomach. So those would be the 2 cancer-directed treatments.
How are surgical candidates identified for pancreas cancer?
So the main requirement in order to have pancreatic surgery for cancer is that the cancer cannot have spread to anywhere else. So unfortunately, that excludes most patients. The majority of patients with pancreas cancer, by the time they come to medical attention, will already have had spread of the cancer to other places, unfortunately. And when pancreatic cancer has spread to anywhere else, we know that surgery does not help. It only harms patients. Even if we can remove the site that the cancer has spread to, it still doesn't help because it's a sign that there are cancer cells floating around in other parts of the body. So the main test that we would do would be a CT scan of the chest, the abdomen, and pelvis, predominantly looking for signs of the cancer spreading to other places. And the main places this cancer would spread to would be the lungs, the liver, or the lining of the abdomen. So that's the main test that we would do, and the main thing that would exclude most patients from pancreatic surgery.
What are the different methods of curative treatment?
Generally, we think of surgery as the only curative modality for patients with pancreatic cancer. There are always rare case reports of patients who do have a dramatic response to chemotherapy or some form of alternative treatment and are still alive many years after treatment. But generally, surgery is considered the only curative modality. And the surgery that is required really depends on the extent and location of the cancer. So for patients with cancer in the head of the pancreas, because there are many structures that come together at that point, the bile duct, the pancreas, and the duodenum all come together at the same point. We need to do an operation called a pancreaticoduodenectomy or a Whipple operation to remove the head of the pancreas along with those surrounding organs and reconstruct it. So that's a major operation that's done for patients with cancer in the head of the pancreas, and that comprises about 2/3 of patients with pancreatic cancer. The remaining third of patients will have cancers in the body or tail of the pancreas. And for those patients, we would do an operation called a distal pancreaticosplenectomy, where we remove the left half of the pancreas along with the spleen. And we remove the spleen because the blood supply to the spleen, the splenic artery and the splenic vein, are really in contact with the undersurface of the pancreas along their length. So we need to remove those blood vessels when we remove the left side of the pancreas, and because of that, we generally also will remove the spleen.
What are the survival rates and prognosis for surgical candidates versus non-surgical candidates for pancreatic cancer?
The survival without surgery is dependent on chemotherapy and the type of chemotherapy and the response to chemotherapy. So if a patient presents with pancreatic cancer and it is either not well enough to receive chemotherapy or chooses not to receive chemotherapy, their average survival would be about 3 or 4 months. If a patient has pancreas cancer that has spread to another place and is treated with the best available chemotherapy we have, their survival would be closer to about a year. So again, still nowhere near as good as we would like, but much better than compared to no treatment at all. In contrast, if patients have surgery for pancreas cancer and chemotherapy, so important that they have a combination of the two, then the chances of being cured of their cancer is about 20%, so about 1 in 5, depending on a number of factors. So again, still not as good as we would like, but much better than what would be seen without any surgery, which is really zero survival.
Why are clinical trials important for the development of treatments for pancreas cancer?
So clinical trials are very important in all of medicine and in cancer treatment in particular. And that's because we can't really make progress without studying treatments rigorously. It's very easy to hypothesize about treatments that might help patients. And in laboratories and in animal studies, quite commonly there are medications that seem to be effective at treating cancers. But unfortunately, even when that's the case, most times when they're tested in humans in a rigorous way, they actually don't work as effectively as we think they will. So it's very important to have well-designed and rigorously conducted clinical trials in humans so that we know which treatments work and, equally importantly, which treatments don't work. So it's really the only way that we make progress. And it is evident that we've made a lot of progress over the past couple of decades in treatments of all cancers, and in pancreas cancer in particular, because only about 20 years ago, we didn't really have any effective chemotherapy for patients with pancreas cancer. And now, we have chemotherapy cocktails that are available that will offer patients survival up to 4 times what they were experiencing before this chemotherapy was available. So it's still not ideal. Again, very few patients are cured of pancreas cancer with chemotherapy alone, and we're hopeful that one day we'll get to the point that we do have effective medications that can cure patients with cancer without the need for surgery, but we'll only get to that point with the development of further clinical trials.